What causes claustrophobia? Have you ever felt a sudden wave of panic when entering a small room or an elevator? This intense fear of enclosed spaces is known as claustrophobia. But what really causes this phobia? Let's break it down. Claustrophobia is a specific phobia that can stem from various factors. It often arises from a mix of genetic, environmental, and psychological influences. If someone in your family has claustrophobia, you might be more likely to experience it too. Traumatic events can also play a big role. For example, being trapped in a tight space or experiencing bullying can lead to the development of this fear. Cognitive factors are essential to understanding claustrophobia. People with this phobia often have negative thought patterns. They might think that being in a confined space will lead to a panic attack or that they will lose control. This distorted thinking can make their fear even worse. Environmental triggers are another significant aspect. Common situations that can activate claustrophobic reactions include elevators, tunnels, and small rooms. Just thinking about being in these spaces can cause anxiety. Psychological factors also contribute. For instance, if a child sees a parent feeling anxious in confined spaces, they may learn to feel the same way. Additionally, having other anxiety disorders can increase the chances of developing claustrophobia. Cognitive behavioral therapy is a common treatment for claustrophobia. This approach helps individuals identify and challenge their negative beliefs about enclosed spaces. Techniques like exposure therapy and systematic desensitization are used to gradually help people feel more comfortable in situations that trigger their anxiety. In practical terms, cognitive therapy for claustrophobia involves a few key steps. First, patients learn to recognize and challenge their negative thoughts. Next, exposure therapy gradually introduces them to feared situations in a controlled way. Lastly, systematic desensitization involves creating a list of feared situations and slowly exposing the individual to each one, starting from the least feared. By addressing both cognitive and environmental factors, cognitive therapy provides a structured way to manage and overcome claustrophobia. Understanding the causes of this fear is the first step toward finding effective treatment. So, if you or someone you know struggles with claustrophobia, remember that help is available, and there are ways to overcome this fear.